Good afternoon, everyone. Hopefully you can hear me okay. This is Wendy Peters Muschetti, and I'm here at LiveWell, Colorado, and welcoming you to our lunchtime webinar to discuss the state of fruit and vegetable prescription programs here in Colorado and across the country. Just a few little logistics before we get going and moving into the webinar. For those of you who have used Zoom before, you're probably very familiar with this. There's both a Q&A and a chat function in your Zoom screen. We will try to monitor those as much as possible. Please feel free to chat us questions throughout the conversation, and then we will address them at the end as we go. And you can use Q&A as well. Chat might be a little bit easier if you can use the chat function. And then we allow time for Q&A at the end. So my first logistic which I want to make sure is, do you all see the title slide? Hopefully we're on the same page here. Yes. Oh yes, a great question already. Thank you. So we are recording. We are now live recording this webinar. And we will send out a link to the webinar to all webinar registrants and partners all across the state of Colorado afterwards. One more exciting announcement I want to make, in addition to this webinar that we will send out the link to, is hot off the presses just this morning. We also have a full report. So a full, 22 plus page report looking at the work that Danielle and Adriana, who you will hear from today, have done, looking at fruit and vegetable prescription programs all across the state of Colorado and nationally. And that report has really great case studies and program summaries of fruit and veggie script programs, again, in Colorado and nationally. And it has information around what they've learned and key findings and best practices, and also recommendations for us here in Colorado. And that report will be emailed to all of you as webinar registrants and other partners across the state later today. So a lot more information coming your way. And one moment, we're just making sure we're technically on the same page here. Great, thank you. So moving on to the agenda. So as I said, I'm Wendy Peters Muschetti. I'm Director of Food Systems here at LiveWell, Colorado. I have the pleasure today of simply introducing the webinar and moderating Q&A at the end. And we're really going to hear from Danielle and Adriana for the bulk of the webinar, and I will introduce them in just a minute. So what we're going to do for our hour together today, just a little bit of an introduction and background about who we are at LiveWell, why are we here hosting this webinar, and what is sort of our interest in this topic. And then our presenters will go into some of the nitty-gritty around specifically what were our questions with the work that they did looking at fruit and veggie scripts, what did they find in terms of benefits and best practices, what were some of the results of the interviews they did of programs in Colorado and across the country. They will even provide a few sort of mini case studies of good work that's going on here in Colorado and nationally. And then to sort of end by talking about, where we really could go and how we could move forward together here in Colorado. And then, of course, we'll have time for Q&A. So I already introduced myself. That's me there at the edge. And then the two presenters that you will hear from today are Danielle and Adriana. So just a little bit about Danielle and Adriana. They are both Masters in Public Health candidates who are doing sort of a required internship as part of their MPH here with us at LiveWell, Colorado for the summer. And we were incredibly blessed to have these two travel basically across the country to come back to Colorado to be with us this summer. So Danielle, as I said, is in the middle of completing her Master's in Public Health with a focus on health behavior and health education at the University of Michigan School of Public Health. She was born and bred in Michigan. She also already has a bachelor's degree in wellness, health promotion, injury prevention. We will also hear from Adriana Collings, who is Colorado born and bred, a CSU grad with a BS in microbiology, and is now in the middle of completing her Master's in Public Health with a focus on the epidemiology of microbial diseases at the Yale School of Public Health. So just really quickly, a little bit about us, for those of you who are not familiar or perhaps are joining us from outside the state of Colorado. Here at LiveWell, Colorado, we're about a 9-year-old statewide nonprofit that works here in Colorado in rural, urban, and suburban communities. We focus on sort of both sides of the coin. We focus on promoting really access to healthy eating as well as active living opportunities. Our mission is to increase access to healthy eating and active living by removing barriers that inequitably and disproportionately affect low-income communities and people of color. Our vision is that we all in Colorado live in environments with equitable access to the nourishing food and physical activity they need to be healthy. So I just want to call out a few of our specific strategic goal and objective areas that explain a little bit about why we as an organization are very excited about this conversation here today. One of our many strategic goals to really achieve our mission is that we help build a sustainable, equitable, and health-promoting food environment here in Colorado. And we have a very specific objective within that, which is still actually very broad. I don't know why I said specific. It's really, really broad, but we have an objective to increase the availability, affordability, and purchasing of healthy food for low-income Coloradans and communities of color. And some of you on the line are probably familiar with the work that we do around Double Up Food Bucks, which is an incentive program for participants in the SNAP program, or formerly food stamps, which is a matching incentive so that SNAP participants use their benefits and we match those dollars so they can buy more fresh Colorado grown fruits and vegetables with their benefits. It is a program from which that we are learning a lot. We do manage that program statewide, but then work with local implementing partners all over the state of Colorado in 28 different counties. And we are learning more and more every day sort of the ins and outs of incentives and really what tangibly is working on the ground to do exactly this, to increase that availability and affordability of health promoting foods in the state of Colorado. And as we've learned more about issues about increasing access and availability of fruits and vegetables, and specifically through incentives, we as an organization have become more and more curious about other types of ways to do availability and affordability and other incentive programs, and have been able to learn from some really fabulous models of fruit and veggie prescription programs going on across the state of Colorado, which you will hear about later today. So as we're going and learning a little bit more and more, we've also been hearing from more and more partners all across the state of Colorado an increasing interest in the specific types of intervention of doing a prescription program for fruits and vegetables for certain populations. So we've seen more and more of these programs emerge in the state of Colorado, and see more and more partners really express interest in wanting to do these and understanding how they work. We do work with a statewide group called the Colorado Food Policy Network, which is a network of local food systems coalitions all across the state. And a work group that has emerged through that network is specifically focused on nutrition incentives. And that work group, again, has brought to our attention that there is increasing interest in really learning sort of the ins and outs of these prescription programs. So as a statewide organization, we have become curious about how can we help advance this conversation. These aren't necessarily programs for us to maybe implement. We don't even know, or maybe to lead or not, but we want to understand how can we help build a community of practice and support a community of practice around fruit and veggie prescription programs and really bring learning to others around the state. And we have the incredible luxury of having students come to us, like Danielle and Adriana, that have the time and the skills and the capacity to really dig deep into these kind of programs. So the work that they're going to tell you about is really what they've been able to learn and glean from Colorado and around the state, and hopefully bring back to all of us so we can collectively have a conversation of, are there ways to really bring these programs to scale and scale them up and increase their availability around the state of Colorado? So with that, I'm going to pass it over to Adriana, who's going to dig a little bit deeper into the scope of work that they had for the summer and their findings. That was my fault. So I'm going to pass it over to Danielle, who's joining us remotely from Michigan, to dig a little deeper into the program. So Danielle, take it away.
Yeah, can everyone hear me? Am I good? Okay. So yeah, so like Wendy was saying, that is really what Adriana and I kind of walked into this summer. We were given free range to turn this into whatever we wanted it to be, as long as we were like following those guidelines of answering those questions. So we started out with a blank slate, and we're pretty organized, and we had a very limited amount of time to accomplish what we wanted to accomplish, because I actually headed back to Michigan about 2 weeks ago. So we sat down and we developed a scope of work to kind of guide our time that we had together. And so the overall goal was to, as Wendy was saying, like kind of assess the landscape in Colorado and nationally and see where these programs can expand or head in the future. So Adriana and I really kind of started in the same place where we didn't really know about fruit and vegetable prescription programs. So May was very heavy for us, just simply doing our research and reading about the different programs around the country. And so we also wanted to be able to assess specifically in Colorado because that's where our focus was.
Danielle? Hey, I'm so sorry to interrupt you. If you could speak a little bit louder, we got a comment that's a little hard to hear. So I'm so sorry. Just project as much as you can so we can hear every word. Thank you, Danielle.
Okay. So yeah, so we needed to sit down and really assess in Colorado what was happening around the state and then expanding outside of the state to see nationally what's being done around the country. And then at the end, we wanted to sit down and analyze those results and see what the common themes were that were appearing and barriers and things like that to kind of help us develop this list of best practices and really help move these programs forward. And then more recently, towards the end of our research, we decided that we had this really wonderful document of 25 pages that we put together. And we thought it'd be really nice and helpful to turn this into a webinar and kind of share it with everyone to help move these programs forward. Next slide. So yeah, so we kind of started out with a large list of goals and objectives to help guide this project. And so some of them that we wanted to really like look into, things that weren't necessarily being answered in some of those research articles that we were reading about online, ways that the partnerships got started. We knew that there were many different stakeholders involved in these programs, but we really didn't know like how did those people come together? And then we wanted to learn about the different models because as we started reading, we started realizing that every program is a little bit different. And then lastly, kind of like, how are they being funded? What does that timeline look like? Where's the funding coming from? And is there room for evaluation? And then one of the larger goals that we had a lot of really great conversations about was to just really like talk to individuals and determine where and how to get these programs integrated into the system, whether that's through Medicaid, insurance companies, or like hospital networks. Or alternatively, gather reasons why this isn't the best approach and what direction should we take instead. Next slide. So starting off with what a fruit and vegetable prescription program is. As I said, there are a lot of different models that are operating around Colorado and the nation. But on the most basic level, it's the idea that a patient is going to visit a healthcare provider or a clinic, and then they're either going to screen positive for things such as food insecurity or they're managing a chronic illness. And then at that point, the physician can either prescribe them to the program, prescribing them on like a pad of paper that they do for normal prescriptions, fruits and vegetables. And so they can then take this prescription, go to the local farmer's market, a local farm stand, or a hospital pantry and redeem that. Alternatively, if like physicians don't want to be that involved, they can just simply refer their patients to the program that an outside organization is running. And then in those models, they were very heavy on education. So at that point, the patients would participate in education classes, and that's where they would receive their incentive to go get their fruits and vegetables. And so there were a lot of different models. Like I said, some were operating through farm stands, farmers markets, some were doing CSA boxes. It just really depended on what that community had within their boundaries and what was easily accessible to patients. Next slide. So evaluation is an area that we're going to talk about a little more in depth later on. But from the evals that we interviewed about, we saw that nationally and locally, there has been a large decrease in BMI, hemoglobin A1C levels, which that's a health indicator for type 2 diabetes, blood pressure, and then some positives of these programs is that it's increasing fruits and vegetable consumption nutrition knowledge, and provider visits. So has been a decrease in no-call, no-shows. And so, like I said, we'll talk about eval a little bit later, but the good news is that of the evaluations that are currently being done, everyone's kind of looking at the same markers and health indicators. There just hasn't been a lot published. We did come across one publication that was shared with us. I think it was just in 2016. The preventative medicine reports, they published, or there was an article published through there from the Fresh Prescription Program in Detroit, Michigan. And through that program, they've actually shown a decrease in hemoglobin A1C levels. And we can share that link too. I actually have it here. I'll share it when Adriana starts talking. And then moving on to our interview questions. We after doing all of our research, we sat down and we had a lot of questions. So we ended up organizing them into 4 different categories: development, logistics, assets and barriers, and fruit and vegetable expansion. So some of the questions that we decided to place into the development category were things like, how did the program get started? Are you able to describe the funding process? How do community needs play a role in the model that was developed? And also in this document that we're going to be sending out after the webinar, we do have an appendix that has our interview guide that has the full list of questions. For the logistics category, we asked questions like, how long is your program? What does enrollment look like? Is there a specific target population that you're aiming to help? Is there an education component? And if so, what does that look like? And who are the partners involved and how did they come to the table? And then assets and barriers, we asked things like, what aspects appear to have the most success? And on the other side of that, like, what are areas that could be strengthened in your program? We also asked too, like, going back in time, what is something that you wish you would have known prior to starting the program? And then things like, what is necessary for a successful fruit and vegetable RX program? And should these programs be focused on local produce, or is it just more important that there's a produce source available? And then for the fruit and vegetable expansion, we had some really great conversations with these big questions that we were asking, and there wasn't necessarily a right or wrong answer, and we didn't know what to expect when we asked these questions. But like, do you see a potential for large-scale expansion? Are there untapped opportunities that you know of that could assist in the expansion? And then lastly, do you see the possibility of these programs being integrated into the larger systems, such as Medicaid insurance companies and healthcare networks? And so we had a lot of really great conversations. And from that, I think it's important that out of everyone that we interviewed, they all were extremely optimistic that these programs can be expanded, and regardless of how difficult it would be a great step forward being able to integrate these programs into these larger systems. And then we'll move on to Adriana, who will talk more about who we interviewed and that interview process.
Okay, hello. So talking about just kind of who and where we interviewed 16 people from across the country and 10 Coloradoans for a total of 16 interviews. And we are going to kind of just showcase 4 of these programs that we found to be either pretty successful or have some very unique characteristics to them. So starting off with the St. Mary Corwin Farmstand in Pueblo, Colorado. This program was started by Reverend Linda Stetter, and they give their participants $15 a week, which gives them an extra 21 servings per person. They kind of found this to be the magic number in terms of what they should be giving people, because it really leads to having almost no food waste. And then this extra $15 a week, it saves about $60 a month, which allows people to pay for other expenses using that money, such as medical bills or gas to go to appointments or things like that. The food is packaged into $3 bundles so that people can just kind of pick those up, pick up 5 and get their $15 a week that way. A lot of the food, or all of the food, is sold at cost, so there's no real profit there. It's all kind of just going back into the program. And then every season that they run this program, they target a different population, ranging from participants with mental health issues or diet-related diseases. And then the farm stand is actually located on hospital grounds, which makes it a lot easier for participants to go and pick up their fruits and vegetables at that current time. And it's also run by volunteers, which reduces a lot of the staff cost. The farm stand is also open to the public, so other people can come and purchase fruits and vegetables there as well if they don't have a prescription. And then one of the more unique things about this program is that when the doctor writes a prescription for the participants, it's taken to the farm stand, and then this prescription is actually scanned right into their medical records. So they have not yet started evaluation, but it will make it easier to do so in the future. So the next one we wanted to showcase was Local Pharmacy RX, which is in Montrose, Olathe, Colorado. And they have a 12-week family education program, which uses the Cooking Matters curriculum. Participants receive about $30 a week, and it's loaded onto a reusable card, which can be used at the Montrose farm stand or farmers market or another farm stand. This program is also run by volunteers, and which also helps to reduce the staff time. This program works to collect a lot of pre and post surveys, and they collect things such as food preferences, fruit and vegetable servings, BMI, blood pressure, and then the family meal frequency, so how often families are eating together every week. And this program also really focuses on coaching participants through behavior change in order to help achieve sustainable long-term health outcomes.
And Adriana, I'm going to interrupt you right there. There's a couple program-specific questions that have come in.
Yes.
So if that's okay, since they're about the programs you just mentioned.
Yeah.
Is that okay? One was quantifying a lot. So quantifying the actual outcomes related to the program. Oh, listen. So we're just doing a quick check on there were a couple of program clarification questions that just came in. So before we move off these specific programs, one is in terms of quantifying a lot, which was a question to quantify the specific outcomes related to the program. There's a couple things that we can share after this webinar that will be in the report and links to the program websites, unless there's anything else you want to add to that.
Yeah, and we just kind of use that general wording because some programs, especially the next two that I'll showcase, have some specific values that are different between the two of them.
And then just to clarify too, there was a great question about when is the farm stand open? Where does the produce come from? And if there's no profit built in, how do the producers afford to participate? So this is specifically around the St. Mary Corwin model. Okay. But just to clarify, there's more in the report, but if there's anything else you want to add.
Yeah, when the farm stand's open, I'm not quite sure about that. But otherwise, in terms of no profit being built in, they really they sell it at cost, and then the producer, we spoke actually with the producer for the St. Mary Corwin farm stand, Luther, from the Arkansas Valley Organic Growers Association, and he specifically said that the farm stand really just looks like a specialized customer for them. They are able to kind of sell them the produce, and the money comes from different funding from the hospital, and they pay Luther for the produce, but other than that, they don't have any like increased profit. Their only other staff member is Linda Stetter, and everything else is done by volunteers.
Volunteers, absolutely.
Yes.
So this is Wendy chiming in as well. We will send around the report, which has more details as well. There is a webinar that specifically focused on the St. Mary Corwin farm stand from about 1.5 years ago. We can send that around where she talks specifically about their funding model. But the producers are paid full price. In Linda Stetter's example, they moved from being funded by their own St. Mary Corwin, the community, the foundation, to then getting money from Innovage and iChip and other partners. So there's grant funding that then pays for the producers to participate, and more information coming.
Okay. And then, so moving on to Fresh Approach, which is located in the Bay Area of California. This program it runs 8 classes over a 16-week period, and they give their participants $7 per person per household for every week of the program. So that kind of calculates out to a household of 4 getting $28 a week, and then $448 over the entire 16-week program. They do a lot to collect biometric data, and they do long-term follow-up, which is kind of one of the more unique things. This is one of the only programs that we saw that did long-term follow-up, and they do it about 12 to 18 months after completion of the program, but that really helps with the long-term evaluation in terms of, kind of evaluating confounding variables and stuff like that. About 35% of their participants they found continue to lose weight after the program is complete. And they've also seen about 75% of participants report maintenance or increase in the numbers of fruits and vegetables that they're consuming at the follow-up. And the last program we kind of wanted to showcase was DC Greens, which runs out of Washington, DC. They've actually been operating since 2012, and they work out of 6 clinics in the DC area. They have monthly group education classes that cover food storage, budgeting, meal prep, and things like that. And they serve children who have a BMI in the 85th percentile or higher, and adults who are at risk or experiencing diet-related chronic diseases, as well as food insecurity. They give their participants $20 a week, plus an extra $5 for every additional family member. And they also collect BMI, HbA1c, and blood pressure levels. And then again, Danielle kind of mentioned HbA1c. It's a measure of the glycolated hemoglobin within your blood, and it kind of just allows providers to look at the patient's blood sugar over past weeks as a measure for diabetes. And then they've also seen about 50% reduction in BMI, or participants have seen, no, sorry, about 50% of participants have seen a reduction in BMI. And then provider feedback also indicates that they've seen a reduction in HbA1c levels. And so these monthly classes actually make it easier for providers to see patients kind of all at one class, rather than having individual appointments for every participant that's in the program. And it's also really effective in encouraging participants to regularly visit their primary care provider. And they've seen, kind of an increase in, or a decrease in no-call, no-shows. And so then moving on to the food providers, we actually had the opportunity to interview 2 farmers, one from Colorado and another from Waco, Texas. And these fruit and vegetable prescription programs actually really boost the local economy when the produce is being bought from farmers in the community. It also allows them to develop relationships with doctors and participants, which is actually really highly valued for them. The participants know that they are eating food that comes from their community, and the farmers are able to know that what they're producing is positively impacting those in their community. And then we also heard that the publicity of these fruit and vegetable prescription programs is actually helping the farmers in their businesses as well. So moving on to the best practices that we've seen for kind of these programs, we just kind of want to showcase things that seem to work the best within 6 different categories for all of these programs in Colorado and across the country. So in terms of how the prescriptions are done, we've seen a variety of things from prescription pads to vouchers to reloadable cards, and it really just kind of depends on your specific program and what works for your community. And that's actually going to be the case for a lot of these best practices, that it's going to be really specific to who you're working with and what works best for them. And in terms of the healthcare providers, it's really important that the healthcare providers want to participate in this program. And then they can either, and their level of participation can vary, they can either actually write the prescriptions, they can come to the education classes, or they can kind of just refer the patients to these programs. So in terms of location, again, it's going to be really dependent on the community. Hospital farm stands, or kind of distribution sites that are on site where the patient visits their medical provider seems to be kind of the easiest in terms of patients being able to collect their produce. These are usually in locations that are already easy for the patient to reach. And then in terms of education, we really found that education is absolutely essential for fruit and vegetable prescription programs. And some of these are, recipes that are included in the food distribution, which is a simple, easy way to kind of get the education component out there. But then some of the more effective or some different types of education can be like evidence-based curriculums such as Cooking Matters, which really kind of focuses more on like long-term health behavior change. And then in terms of food source, it's really important to have local produce just because, that's stimulating the local economy and supporting the farmers in the community. And then in terms of data collection, this is really kind of one of the biggest components that we wanted to focus on. So it's important for the data collection to be comprehensive and periodic, as well as also to have like some sort of long-term follow-up. And we would really like to see just kind of maybe a standardized way across Colorado or something along those lines to, be collecting weight, BMI, blood pressure, HbA1c, and just make sure that it's really thorough so that further analysis can be done. And Danielle will go into that a little bit more.
So I'll get started talking about some of the barriers that started popping up through some of our interviews. And so we did ask a specific question about these the barriers to these programs, and these were some of the most common answers that we received both locally in Colorado and nationally. So one of the large ones we heard was it's really difficult to get medical provider buy-in. So doctors and physicians, healthcare clinics, they all have a lot on their plate right now. And so trying to get their buy-in to these programs, it's another thing that they have to do. And actually some physicians, a common thing that was coming up in our interview is that physicians didn't necessarily know how to like talk to their patients about nutrition, and if they didn't have a solution to the problem, they kind of preferred not to. And obviously that's not the case across the board, but it was just something that kept coming up in our interviews. So getting medical provider buy-in was a very large barrier. Additionally, a sustainable funding source was brought up a lot. Some of these programs that are just beginning to pop up are running on mini grants that are only lasting a year. So the idea is that being able to integrate these programs into larger systems will increase the longevity of these programs and hopefully be able to reach more people. And so moving on to this idea of evaluation. So like I said earlier with eval is that there's a lot of small evaluations going on. Some programs simply don't have the funding to put into evaluation, so they're just doing as much as they can. And so we were thinking, and I'll talk about this in our like future directions and how to address some of these barriers, but there's just really a lack of a streamlined evaluation in being able to kind of like leverage this data, because everyone's kind of doing the same evaluation, BMI, blood pressure, some of those other markers that I talked about earlier, and just being able to collaborate on that and leverage those. Also, the availability of farmers in some regions. Being out in Colorado, I learned very early on that the regions and the growing season is very short. And that wasn't necessarily the case for the program in California that we interviewed. They had a really long growing season. And so some of the barriers that we found in Colorado was that there's just a lack of local produce due to the short growing season. And they were trying to find ways to get around that. And then lastly, some of the programs lacked an education component, and that also can be contributed to lack of funding. And so moving on to addressing barriers and some of the future directions that we kind of compiled after looking back on all of these interviews. So funding options. Ideally, in a perfect world, a patient would be able to go into a healthcare clinic or their primary care doctor's office, and if they qualify for this type of program, the doctor can write them a prescription for fruits and vegetables to solve their problems rather than a medication or prescription. And also fruits and vegetables, there has been some research published that like they are cheaper than the pharmaceuticals out on the market right now. So that's financially a plus for these programs. But in order to get into some of these insurance companies, it's going to require a lot of collaborative data. One of the barriers that was brought up in, I'm trying to think which interview it was, but they tried to take this approach, and there was the lack of long-term benefits. So the insurance company or the larger system wanted to know, once the patients leave these programs, are they sustaining these like positive health impacts, and how do we know that what is happening after the program is like can be related back to the program? So obviously, like I said too, being able to streamline an evaluation and compile everyone's data points, that increases the size and increases the numbers, which can make a bigger impact when presenting a case to some of these agencies. Another area that we were introduced to, completely brand new to Adriana and I, was the nonprofit hospital sector. And so we learned that community benefit dollars could potentially be an entry point for some of these programs, as long as the fruit and vegetable prescription aligned with the community health needs assessment that these hospitals are required to do. And so obviously every healthcare system is different, but it's worth having a conversation. They are required to put their dollars back into the community every year, and they all should have a community benefit coordinator, and it would be a nice way to start talking about this as a potential opportunity to integrate, maybe with something that they're already doing, but it's a good conversation starter. And that was another future direction that will come up later too. Next slide. And so when looking at expansion, we also found too that because the education component varied from program to program, there are a lot of already existing nutrition education programs occurring, but they are kind of lacking that incentive. So this would be a great area to integrate these programs with. And so rather than some of these individuals completing these nutrition education programs and learning all of this really great information, but not having the means to go home and buy the produce that they've just learned how to prepare, this could just be an additional funding point where you could incentivize some of these programs. And then more recently, we found out that Medicare will begin covering the diabetes prevention program in 2018. So another entry point could potentially be integrating with this program, and I'm very optimistic, but after many years of evidence and research compiling on each other, it's finally being funded. So there is hope that these programs, if the data and eval is leveraged and positively impacting the health of large amounts of people, that this could be another opportunity for these types of programs to become more large scale. And then lastly, convening and organizing of stakeholders. One of the programs that we interviewed in Michigan, they simply brought a bunch of stakeholders to the table and told them about these programs and told them the potential impact, but really just bringing the stakeholders together is another way to promote these programs and kind of get them started in communities that really need it. Next slide. So moving forward with some of our recommendations that we left with LiveWell, and hopefully can be generalizable to other areas as well, but it would really be helpful if there was a statewide evaluation plan. Not knowing who would lead that evaluation, but statewide data is really needed and necessary to get buy-in from some of those larger health systems and insurance companies. And obviously they want to see a return on investment. So being able to compile all of that data and really being collaborative on an eval would help funding for these programs as well. And then convening of partners and creating a space for programs around the state to connect with each other. I'm assuming that a lot of you tuned in today because you're really interested about these programs, and we hope that the conversation doesn't stop after this webinar. But being able to have a place for data sharing and the great funding sources, the best practices, and how to expand these programs, just getting people that are interested around the same table and having conversations about how to start making progress with some of these programs. Next slide. So some of the further questions that we had that we simply just weren't able to answer in the time that we were allotted is Medicaid a viable option for these types of programs? We didn't get a yes or a no. We heard that it would be very difficult, but could be a potential opportunity. And like I said, after lots of evidence and data that has been provided by a diabetes prevention program, Medicare is going to start funding it. So down the line maybe, but we need to start looking at other ways that we can get these programs expanding and reaching more people potentially sooner. And so then how do we conduct a long-term data collection and minimize the confounding variables? So like I said, how do we minimize the what ifs, or who knows what participants are doing once they leave the program, but also just having enough funding to be able to do a post-program 6-month evaluation to see whether BMI is remaining or decreasing, and some of those other health markers as well. And then having the conversations with health systems, that community benefit coordinator, like what do the health systems need for these programs to fit within what they're trying to achieve as well. It's just another potential entry point that we thought would be a great place to start. Next slide. And so we really just want to say thank you to everyone who took the time to sit down and have a conversation with us. We had a lot of interviews, like Adriana said, we had 16. We talked to a lot of people in all of the programs very, very greatly, but there were a lot of similarities and commonalities of the barriers that we were hearing. So thank you to everyone who was able to sit down. Our interviews ranged from 30 minutes to over an hour. And it was really, really beneficial to give us content to move forward with our project. Also a special thanks to LiveWell for giving us this great opportunity and space to learn more about these programs. I know that for myself and also Adriana, we learned a lot more about this area than we knew coming into our internship. And also thank you to all of you for tuning in and listening. It was a great project. I'm very invested in these programs now. It was great learning about the different models and funding. So yeah, so thank you everyone for tuning in. And we are open to any questions. There's a lot that we didn't cover in this webinar, but it's in that large 25-page document. And there's also some more resources in the back of that document too that will hopefully help you do more research of your own and have these conversations about fruit and vegetable prescription programs in your area.
Great. Thank you, Danielle. And I would just like to echo a little bit of what Danielle said and sort of sharing a huge thank you, particularly to our Colorado partners across the state who provided so much of your time and wisdom about the good work you're already doing. And with no immediate reward, you all shared so much of your time and wisdom with us. So thanks again to all the folks who participated in this work. And we have some questions coming in already, and I just want to add a couple. I want to address a few of the questions that have already come in. And while I do that, please, if you have not had a chance yet, please type in your questions as we go. And just a quick reminder as well that we will send out after this, we will send out a link to this webinar, the link to the published report in preventive medicine that Danielle and Adriana mentioned. We will also send out the full report that Danielle just mentioned. We'll also share a link to a webinar that was specific to the St. Mary Corwin Farmstand webinar, which was from last fall. And we'll also, as Danielle mentioned, there's a lot of resources in the paper. But in addition to what you can read in the report that Danielle and Adriana have worked on, there's a national partner called Wholesome Wave, which nationally is really building a network around incentives and specifically fruit and veggie prescription programs. So Wholesome Wave is a really great national resource, and we will include links like that in our follow-up to all of you. So just to quickly touch on too, there were several really good questions that came in as we were talking about really wanting to dive a little bit deeper into the evaluation, sort of the tools and the mechanisms and the results from all of these different partners. So what we will do is we will follow up with all of our local partners and see if they're in a position where they can or they're comfortable yet to share any of their sort of pre and post survey or evaluation tools and any other of their sort of published evaluation. There are a lot of good questions about exactly what people are measuring and what they have found and what tools they use. So just a heads up, we will also try to do a little digging and share those tools more broadly with webinar registrants. So keep your eyes open for more emails from us. And a couple other questions that come in, a really great question around sort of the nutrition education component and really wondering if that piece really needs to be mandatory or if that could actually feel a little bit paternalistic and sort of, going off the assumption that, if you are food insecure, that perhaps you lack those skills or knowledge of what to buy and how to cook it, and kind of what role those programs could or should play and when that's appropriate in these fruit and veggie script programs. So Danielle or Adriana, do you want to share anything that you heard about that?
Yeah, so I would definitely say that the education component is going to be really different based off of the area that you're in. So, for example, local pharmacy RX, they use the Cooking Matters curriculum, but then the St. Mary Corwin Farmstand, they use recipes. And I think it just kind of depends on the population that you're working with and whether or not they find that valuable, or if maybe they would think that is paternalistic in a way, then maybe including recipes with some of the food items that include some of the food items you're distributing might feel a little bit less paternalistic and just more of like helpful information.
Mm-hmm.
Yeah.
Yeah.
Also too, like it just depends on your turnout as well. But for like local pharmacy RX, I saw that as more of a space for families to come together and cook together in one kitchen. And I don't think that, I think the communities and the programs that were working in their communities, they were doing it to fit the people that they were serving. And so if a specific education component wasn't working, they would change that to make sure that it was, because the idea is to get people to consume more fruits and vegetables to improve their health.
Yep. It's interesting. It's an issue that comes up quite a lot with Double Up Food Bucks as well, as an incentive program that started at and still primarily works in farmers markets. But I think what we have heard from Double Up Food Bucks is this is actually a request we hear a lot from the community and from community partners, is to have that nutrition education aspect of it, because farmers markets, however much we love them, may not always or not always have been the most welcoming or inclusive environments, or where perhaps low-income shoppers think they can go or feel that they are welcome. And so having partners like Cooking Matters that actually built an entire farmers market specific curriculum is critical, because they just may be new types of ways of interacting, right? New places to shop, if it's a farm stand or a farmer's market. The way the local pharmacy RX program runs in Montrose is they are certificates for the farmer's market. So knowing that that may be a new type of retail environment, I think what they have found is having that kind of bridge about what may be different about shopping at a farmer's market has been really important. And it's a great question. I see that Cooking Matters has been sharing in the chat function links to Cooking Matters recipes and other support that they provide, and we can make sure that these resources go out and follow up to all of you as well. So a couple of other questions came in from the sort of the producer side around if there's general agreement or menu of food items that satisfy these prescriptions, right? So I think it's a great question about how do we know sort of what to grow? So the follow-up questions is that farmers really can target this, right? They can grow and deliver what needs to be delivered if we know what it is, right? So I think the question is from the producer side, did you hear in any of the models that you spoke with that they actually are tailoring what is produced and delivered, like say, for a certain diet or for a certain health outcome? Did you hear of any programs or models where they got that specific when they worked with their producers?
Not that I'm aware of, we didn't interview really anybody who was working with any specific disease. Most of them were just working with just kind of diet-related chronic illnesses that could be just, helped with fruits and vegetables.
Danielle, anything else to add?
Yeah, no, we didn't come across anything that was that specific.
Yep. So, and it's a wonderful question, I think, that maybe isn't calling out another perhaps need for some more streamlined and standardized evaluation as well. But then also, as we move forward, looking at how can we really work with producers to identify what's most needed. So we're not, say, flooding a farm stand with a bunch of spinach, how much we love spinach, that may not be desired or well known or diet, for nutrition wise or dietary needs, like what sort of the families in that community need. So it's a great question that we should look more into. Other questions about, I'm wondering if you two heard in any of the interviews that you did, anyone tracking the economic development aspect? So did you come across anyone that's actually tracking, besides just sort of dollars that were created, any of that economic development side of it? Well, they're documenting that yet.
Yeah, so we wanted to. Adriana was trying to do a cost-effective analysis, which we were able to gather enough data to start tapping into that. But since the programs are so new, and unless it's a really large-scale program that has been operating for a decent amount of time, that data just isn't available. I think there's a program in California that was mentioned that they were trying to do an economic return on investment report, but we just didn't have the time to get in connection with them.
I am personally really enjoying all of these questions and comments because I feel like collectively, everyone out there who's participating, you're helping us really build and grow a program and evaluation here. So I just wanted to say, if anyone hasn't, we will send out all these questions and comments because they're really fabulous. And I also should have said from the beginning that we are learners along with all of you right now here at LiveWell. We launched sort of this summer study because we want to learn these things too. We want to explore and see what role ours could be. So also caveat that we don't have great answers to all of these amazing questions, but we really want to be committed to learning them and finding those answers out together. So other great questions that came in. Yes, great, thank you. Someone did just point out that Michigan State just did a webinar about the economic impact for producers that are involved in some incentives, and we can send that out as well. And I was gonna say something similar, is that, so there was a healthy food incentive economic development webinar done with our partners, Fair Food Network, who we work with to do our Double Up Food Bucks Colorado program. Excellent webinar. Again, we can send around the link or the slides to that. And also there's what we do in terms of say Double Up Food Bucks and the economic development piece is there are studies on economic development of local purchasing of foods, and there are studies done by the USDA on the economic development of farmers markets specifically. So that's sort of how we talk about, as an example with Double Up Food Bucks, is we know what kind of dollars are going from Double Up Food Bucks to local farmers and farmers markets. And then we know broadly, because of national studies, that these dollars have what kind of economic development effect. So it's sort of, we're associating ourselves in that way. And again, we can share a lot of this information. And then curious about the sustainability of the program. So a way to track the effects of participants after the program ends. Again, something we're very curious about, Double Up Food Bucks. We asked the same question. So did you two come across any programs where they're doing that sort of long-term tracking of participants after they were involved in the intervention?
Yeah, Fresh Approach in California is working on, they do a long-term follow-up about 12 to 18 months after program completion. But in terms of, and then they're using that just kind of to help with their evaluation.
Okay. And there's more about that in the report as well, or we get links to the actual program?
Yeah, we can have links to the actual program.
Okay. And again, I mean, from your, is this perhaps something else that they're calling out that perhaps we're identifying needs to be involved in a broader evaluation, is more of that long-term follow-up and tracking?
So okay. One of the things that would be beneficial is to have kind of a long-term follow-up, especially because there are, a lot of confounding variables that can be associated with kind of in this evaluation.
Absolutely. And I think part of the question too, this question is getting at is, in a way, is it almost kind of a one and done? Like once someone isn't involved anymore, are they still left without any buying power, right, to purchase any more fruits and vegetables once they're no longer in the program? And I think it's a great question. I think what we know more about is how programs like this may shift behavior change, right, in terms of what knowing how to shop at a farmer's market and knowing what's available, knowing how to shop seasonally, knowing how to, and building those skills and awareness around shopping on a budget that tend to lead to sort of more longer term behavior change. But I think the broader question really is, are we changing that broader food environment so that accessibility and affordability becomes the norm, not just because you have to participate in that one program? So I'm calling this out because I think it's an incredible question that we probably don't have the answer to after this research. And I see that Cooking Matters is sharing in the chat box as well some long-term evaluation from their farmers market tours and other resources. So thank you for sharing those, Cooking Matters. And I'm just doing one last check if there are other questions. Yep, so another question that came in, did you in this research find any health providers or funders who were interested in qualitative, I don't know why it's not, sorry, I'm not reading. Sorry, I had to pull it up on my screen, everyone. So funders or providers who are interested in qualitative data pairing with the quantitative, right? So the question is, we do not measure health indicators like BMI with our clients. We have extensive qualitative feedback from our incentive program clients. So I don't know where this question is coming from, but are there models that you guys heard of where they are pairing that qualitative feedback in terms of, yes, I'm buying more fruits and vegetables, my family's eating more fruits and vegetables, pairing that with those quantitative health indicators?
Yeah, so local pharmacy RX is a good example of that. One of the programs that we talked about, who they are collecting participants' food preferences before and after the program, the number of servings of fruits and vegetables that they consume before and after the program, as well as BMI and blood pressure. And they're also looking at the family meal frequency, so how often families are eating together. And in terms of kind of just focusing on either qualitative or quantitative data, I think the hard part with that is that, sorry, I always get them confused. Qualitative data is really easy to kind of have there, but people who are looking to fund these programs, or people who we want to look to fund these programs, such as insurance companies or nonprofit hospitals, are really going to want that quantitative data. And that's part of the evaluation that we would really like to expand on, so that they actually can see numbers, and because that's what they want, unfortunately.
Mm-hmm. Any other examples, Danielle, that come to mind?
I mean, I just think right now that there is an abundance of qualitative data, and the quantitative data that's available right now just isn't significant enough to make these cases. Ideally, having both in order to present that case that's like the gold standard. But you can't convince a large insurance company or health system that your data is significant when you only have 12 program participants. So being able to present statewide data where you can have hundreds of participants' data being shared, that's going to hold a little more weight. But I think both is really important when presenting that case.
Absolutely. And I know we're getting up right against our hour, and I do want to take a minute just to share a little bit about what we are doing as next steps at LiveWell, just to be very clear and transparent. And also so you know how to get in touch with us if you're interested in working more on this. Incredible questions that have come in. I think I have missed some, so I apologize. But one was about ideas for data sharing around the country. We want to know the same. We want that answer as well. I would say being a part of the Wholesome Waves National Nutrition Incentive Network would be the place that I would start, and we are trying to start, and really encouraging them to help bring some best practices around data collection and evaluation, and building sort of that national community, learning community would be the place to start. Another question was about any cultural or language barriers that came up in anything that you heard. So actually, I'll take that as the last question, then I'll share about what we're doing next. But did that come up in any of the interviews that either of you did around they came across cultural language barriers and how they address them?
Well, I think it's Local Pharmacy RX that actually has 2 curriculums in Spanish. I think it's either 2 or 3, but they've actually expanded that from when they initially started because they realized that they had such a large Spanish-speaking population. But it really depends on your community, and when getting started with these programs, you just have to assess the community that you're working with and provide resources that will help them.
And one thing about evaluation as well is that we will, work with our partners, specifically St. Mary Corwin. Linda actually couldn't be on the webinar today, although we asked her to be as well, but they are tracking, their data is integrated into their, electronic health records. She is collecting all of that, the quantitative data, and has some really extensive testimonials and all of that qualitative data. She really has an incredible she's sitting on quite a lot of data, quantitative and qualitatively, so we can follow up with her and ask her what she's in a position to share for sure. And just as you probably need to get off, but just to be clear, and so as I said, LiveWell Colorado is really sort of at a place of learning about all of this. So again, these questions and comments have been profoundly helpful to think about what we need to do moving forward. In order to move forward, I did mention the Nutrition Incentive Working Group of the Food Policy Network, and working closely with that work group and the Food is Medicine group out of the Colorado Prevention Alliance. We will be working collaboratively on a grant application, the CCPD grant, if you know it. It's the Cancer Cardiovascular Pulmonary Preventive Grant. I'm sure I got that wrong. Distributed by our State Department of Public Health and Environment. But we will be working on a collaborative grant application to do 3 primary things. So one is to bring some of these best practices and some standardized evaluation tools across the state of Colorado to and how can we support the programs that are already doing so much by bringing in that evaluator for the entire state and to document a lot of these outcomes that we're talked about today. A luxury of time that some of these programs honestly sometimes don't have. We also will continue to advocate on a national level. We were just with our some national partners last week, the National Sustainable Ag Coalition, working on our local foods marker bill, and one piece that is still in our marker bill for the next farm bill is specifically a federal grant program for produce prescriptions, and we provided extensive feedback to that ask. So we will continue to do federal advocacy work as well to better support these kind of programs, as well as doing some local fundraising. And I skipped over the rest of our CCPD grant application. We'll do evaluation, some resources to really build a more Colorado community of practice and bring these folks more together, to share, to learn from each other, and then also actually bring some incentive dollars to help scale up some of these programs and bring them to more hospitals and healthcare centers in Colorado. So stay tuned on that grant application and some of our federal work. Email me whenever you want. And I think, I'm stuck on Q&A. We're gonna go to our last page. And it's not on there, and I apologize. If we can, I will chat it in right now. My email is wendymuschietti@livewellcolorado.org. I'm going to chat it in right now. You can always email me with more questions or more information or thoughts or comments or how to get involved in more of any of this. And I just emailed out my email. Hopefully I typed it correctly, wendymuschietti@livewellcolorado.org. And you will hear a lot from us. It sounds like we'll have a lot of follow-up. I really appreciate all of your time and participation, it looks like from all over the country. So happy Monday afternoon, everyone, and thank you so much, Danielle and Adriana.